Ladies and gentlemen, are you ready? I have my two colleagues here, whom you know very well. Professor Nyang Nyong is the host governor of Lake Region Economic Bloc. Governor James Ongwae is the vice chair of the Lake Region Economic Bloc, and he also chairs the health pillar at the Lake Region. And I am the chairman of the Lake Region Economic Bloc. Three of us formed the summit of the Lake Region Economic Bloc. So we are here on behalf of our other 11 colleagues who are not here. We will have a full Lake Region Economic Bloc Council meeting on Friday, where we will discuss other issues plus what we have discussed today. And today, we will confine ourselves to the COVID-19. So this is a statement on COVID-19. As you are aware that Lake Region Economic Bloc was declared as a hotspot by the national government. So, ladies and gentlemen, the pandemic is real and brutal within the Lake Region member counties, which over the last 1 week has been the hotspot for the country as a whole. The cases are exponential, rising beyond the capacity of the health system to manage, and we have several of our loved ones with our people continuing to die in increasing numbers. In the last 1 week, COVID-19 new cases in the region stood at 2,171. The period being between 14th June 2021 to 20th June 2021, up from 1,589 the previous week. The highest number of cases are from Kisumu County, 451, Siaya County, 446, Busia County, 263, and Homa Bay County at 220. Total cases as at 20th June 2021 in the Lake Region Economic Bloc stood at 28,866, accounting for 16.1% of the total confirmed cases nationally, being 179,075 in number. The trend can be seen in a graph, and we have a graph where you will see it. In the meeting held on 13th June 2021, the Lake Region Economic Bloc governors engaged with the National Ministry of Health and made decisions to flatten the curve of the pandemic in the region. The meeting was followed by the National Emergency Response meeting on 14th June 2021, which was attended by Professor Nyang Nyong here on behalf of the Lake Region Economic Bloc. The resolution led to the actions as follows. 1, joint LREP COVID-19 response coordination. This will ensure will promote inter-county cushioning and sharing of resources and services in a coordinated manner. An LREP coordination response team to be constituted immediately to undertake regional inter-county tasks. Governors to hold immediate in-house meeting for a concrete regional plan to fight COVID-19 in a joint manner. Weekly strategy and reporting meetings to be attended by governors and CECs in charge of health and LREP Secretariat. Monthly meeting between LREP and Ministry of Health. Number two, prioritize data for decision making. An integrated online data system to be established to inform and facilitate the inter-county activities. Reports to be shared timely to the coordination agency and to every secretariat on daily basis. Online chanjo system to improve on the entry backlog for better accuracy for tracking of vaccination. Mapping and evaluation to be done on resources and services. Number three, prioritize prevention for COVID-19 infection since vaccines are not adequately available. Adopt a rapid testing which is more cost-effective to improve case detection and focus on border and hotspot counties of Busia, Migori, Kisumu, Kisii, Kericho, and Siaya. Decentralize the rapid testing to all sub-counties. Harmonize enforcement of public health measures. Upscale risk communication and information through various media to influence desired behavior. Undertake circuit breaker and restrict human movement and interaction in funeral, transportation, churches, bars, and hotels. Set up contact tracing and community surveillance. Continue profiling and monitoring the vital strains in LREP region. Actively engage health and other professional bodies on vaccination and technical support. Increase call for citizens to come for testing, pass oximetry, and link with the increased isolation capacity. Set up healthcare tents. Endeavor to fast-track procurement of life-saving vaccines. Number four, management of COVID-19 in hospitals, communities, and households. Active case finding and admission of cases due to the highly transmissible prevention Delta strain within Lake Region Economic Bloc. Operationalize the health infrastructure like ICUs, coordinate and optimize sharing of specialized skills and services, optimize available oxygen capacity in the region through sharing and procurement arrangement within the region. And as I can tell you, Kisii has about 300 liters per minute. Kakamega has nearly the same. Kisumu has nearly the same. So we have agreed that we now have to import more oxygen production equipment. Establish and harmonize referral mechanism between counties. Strengthen home-based care and monitoring of community level through capacity building. Improve vaccine management and information at county level. Human resources to be well supported with the resources, and human resources to be supplemented with the students and nurses from medical training centers. Various resources to be actively obtained from Nairobi, vehicle to be sent to collect. Summary of priority action. In stemming the tide within Lake Region Economic Bloc, work collectively sharing information, resources, and initiatives, and that's what we are doing. The most effective way of stemming the pandemic is to consider a circuit breaker in the form of lockdown in the Lake Region hotspot to control the spread, well worked out strategy to limit movement of persons, while at the same time appreciating the need to maintain economic activity. Strengthen enforcement of the COVID protocols to the letter. Provide enough resources, oxygen, human resources, for health testing kits. Establish an online integrated data information for coordination. Establish an LREP task force to implement the joint plan of activities. Fast-track financial flow to counties from National Treasury. Conduct LREP governors' weekly meetings for updates and monthly engagement with the Ministry of Health. Conduct weekly review meetings with CEC in charge of health on the situation. LREP governors to attend the National Emergency Response Committee meeting the next Monday at 2 p.m. We are calling upon all members of the society to join the war through the system in whichever way possible in order to stop the spread of the virus. Support the frontline staff and vulnerable members of society. We remind those who are sick and unwell should report immediately for treatment without wasting time, since the current beta strain of the virus leads to a more severe disease and is rapidly progressing in the families and community. Continue to wear a mask, wash hands, and keep distance. Reduce the crowding and being the risk spaces, such as bars and social grouping. Keep being active and checking on loved ones in the same way. Join and support the Adopt a School initiative and innovative strategy by our appointed LREP committee of eminent persons to lend a hand in this work. That's what we had. It was fairly detailed. I will just give our host here to also just give a comment, and finally, before the host, let the vice chair also make a comment.
Thank you very much, Chair. Thank you very much, Chair, for the exposition that you have given for the region. I really don't want to say anything, but I just want to add three things. One, the stage that we have reached in this country, and especially in the region, this is not about us as individuals, as human beings looking at government. This is about us looking at ourselves. So as members of the Fourth Estate, you need to tell our brothers and sisters that this is no longer about waiting for government to do something to you. This is about us as human beings taking action through ensuring that the protocols that we've been told are put in place, issues of masking, issues of distance, issues of hygiene. I think if we do that, then we can be able to manage this pandemic. And it's upon you to pass this message, because as governors, as individuals, we can pass this message to our brothers and sisters, both through the electronic and the print media. The second issue I want to talk about is about testing. The capacity for our national government to test all the Kenyans on COVID-19, we must all agree that that capacity does not exist at the moment. So it is incumbent upon the Ministry of Health to allow rapid tests to be undertaken as a first step, because once the rapid test actually identifies that you have COVID, even before a confirmation is done through a substantive test, either through Kemri, Kisumu, or other areas, at least that particular person should start the initial treatment. And we are a bit worried in the region that even the protocols on rapid tests have not actually been given by the Ministry of Health. And the whole issue of rapid testing is also shrouded in mystery. I think a stage has reached when counties should be allowed to buy the rapid tests. What actually needs to be, if the national government can't buy, or if donations cannot be brought, what needs to be done is for the Ministry of Health to issue the proper protocols. Otherwise, we keep on fending on this thing, then we are going to run into problems as a country, because we do not have capacity as a country to do the serious testing that we need to do, because our experts are now telling us, and we had Professor Kamarogo with us in the morning, according to the discussions, our numbers, not only in this particular region, but probably throughout the entire country, the numbers are oscillating between 20 to 40%. So as we are standing here, quite a number of us might be sick, but we do not know about it. Finally, the issue of oxygenation. We were looking at our oxygenation capacities. Fortunately, the 3 counties here, Kisii, Kakamega, and Kisumu, have oxygenation plants. But these plants can only give about 300 liters per minute. A patient needs about 50 liters per minute. What are we talking about here? We need to increase capacities for oxygenation in the region. For us, fortunately for some of us, we are able to supply some of the oxygen to the other hospitals that don't have, but this is not enough. So I think, again, national government needs to help us on infrastructure development in the whole area of oxygenation. So finally, ladies and gentlemen, I would say that as counties, we have all agreed that we work together, that if there are patients that cannot be taken care of in Mutembei, for instance, or in Kisii, or in Migori, or in Nyamira, and there's capacity in Kisii, I think hospitals is like water, you don't deny anybody. We have agreed that we work together as a region, and we are going to have further meetings like our chair has indicated, where all these issues will be brought out much more clearly. Thank you very much, ladies and gentlemen.
Thank you very much, Chair. Thank you very much, Jim. I won't say much, ladies and gentlemen, but I want just to add what Jim has said about testing. It is true that the national government is not going to be able to test as big a population or sample of it that can tell us the extent of the spread of COVID-19. But if the national government can work with us in the counties, we have consulted, the 2 of us, including our experts, that we are capable of setting aside some resources to buy rapid test kits from abroad. You can get a rapid test kit from South Korea for about $3. And we can set up some money aside to buy a rapid test kit, but we need permission from the national government to do so. We are prepared as counties to do that, so that we can know much more accurately the extent of the spread of COVID-19 in our population. And then using a stratified random sample, we can even be more accurate. So from the stratified sample, we shall know the extent of the spread, and then we can also target the risk groups to test them specifically. So this is something that we are going to propose to the Minister of Health, and if they are agreed, we 3 here representing the Lake Region Economic Bloc, for our colleagues, we are prepared to move that way. Secondly, with regard to vaccination, as you know, it was announced yesterday in the papers, and I think in the papers today too, that we are soon getting some vaccines in August. But even that number will not be enough. New York has proved that if you vaccinate over 90% of the population that needs vaccination, you can put COVID at rest, by the way. And New York has now gone back to normal. If we were allowed as counties to import vaccines, even working with our development partners, we are prepared to do so. We are appealing to, through this media, to the national government or Minister of Health to listen to our cry. Kilio cha wananchi who want to know their status, so that we can intervene much more accurately as counties. And lastly, the good news is, though Jim has talked about oxygen, that word is very difficult. Having oxygen, anyway. He is doing very well in Kisii County, by the way, in terms of having enough oxygen to share with his neighbors, Nyamira, Migori, and so on. Paranya and I are overstretched. But the good news is that my friend Victor for Paranya is getting an oxygen generating equipment or machine by the end of this month, or sooner than that. 1,000 liters per minute. We are also getting one by the end of June. I think
we are also getting one.
We are all getting something to improve the oxygen capacity in our counties, including what we have. So, because we are aware that as this thing is likely to go up exponentially in the next month, as Kama tells us, we are forewarned. Therefore, we want to be prepared, and we are. So we are assuring the public that we are doing the best to make sure that oxygenation, yes, I got the word now, will be done in our counties. Thank you so much, Mr. Chairman.
Yeah, maybe let me invite our chair of the eminent persons, just to make a brief comment, because these are the people who give us all this information. These are the experts.
Thank you very much, Your Excellencies, and thank you, the media. I stand here on behalf of the Advisory Committee to LREB of eminent persons that I chair. I want to confirm that all the restrictive announcements that have been made here are based on our recommendations. They are not political, they are purely scientific. And we have been forced to tell the governors to do this for several reasons. One, it is very, very clear that we are in the middle of an existential war against this virus. Today, as we stand here, I would like each one of you, including the media, to treat yourself as if you have COVID already. Treat your best friend as if that person has COVID. In fact, my observation is that the distances that you are keeping from each other are already breaking the protocols. I'm saying this because the variant that we are dealing with now, the Delta variant, is up to 10 times more virulent than the previous ones and more severe in terms of its effects. So imagine if something is more infectious than before. Two, our data is very, very clear that this is no longer a problem of old people. The majority of positive people now are teenagers, young people in their 30s and 40s. And when you go to see your parents, you are taking this virus with you. So our appeal is for personal discipline, for community discipline, and above all, for us to take care of ourselves and of each other. The governors are doing their best, and I can confirm that these three governors, their hospitals are the best in terms of oxygen provision and care. But I can also confirm that please don't wait for oxygen. By the time you require oxygen, it is too late. And there's no doctor, no nurse, and definitely no governor who's going to save you. And finally, let us think and care for our health workers. They are stretched, they are tired, and they are getting sick. And we do not have a pool from which we'll be pulling new ones to come and help you. So if your intention to ignore prevention is because you think that there's doctors and nurses, then know that you're putting a necessary load on them. This is a problem we can beat. There are parts of the world that have controlled COVID without vaccination. Behavior change. That's affordable, and that is the only thing we have at our hands. Let us not wait for the kind of thing that we saw at JKIA last night, where Denmark is bringing 300,000 doses of vaccine and 50 million people are waiting for that vaccine. These 50 million people must decide that we can prevent COVID from getting to us. Thank you very much.
You said 50 people, 50 million people. Any question? You know, Lake Region Economic Bloc has taken a step, a notch higher than even the national government, that we have a committee of eminent persons chaired by Professor Kama Robo. to give us all the statistics and a vibrant secretariat. And that's why we were able to know that we were going to be a hotspot in the near future. And we took the precautions that we have taken. And that's very important. Yes?
My name is Dr. My first question is recently the governor of Mombasa County, Joko, extended a hand of support to Kisumu County by insinuating that he is ready to provide some health workers or experts to bridge the gap that Kisumu County probably may have. As that happened, and two, before you came, there was another team here of business community who are giving some donations. One of them suggested that is it possible to close the schools because it's trying to also insinuate that the schools being on may also add to after the spread of the COVID-19.
This is for you. The two questions. One is in Kisumu.
I'm happy that the businessmen came here and did something. That's very good. I applaud them.
Yeah.
But you see, I was away in Cairo. I came back on Sunday. Nobody has told me that Joho has sent a hand of support. I'll call Joho soon after this. Yeah. And then I can call you in the afternoon and let you know what we have agreed. Yeah. That's very simple. It's a very simple transaction between the two of us. We know each other very well. The business people suggesting that close schools, I don't know, but I think that schools are not as dangerous as funerals. Yeah. You guys go to funerals, congregate in thousands, notwithstanding the COVID rules, then you eat, and when you eat, you can't put on, and then you go home and die. That makes sense. Please let those who have died be buried by their families and protect your lives without even referring to the school children. Secondly, honestly, like Hama said, if we behave responsibly, each one of us, you will find that in schools they behave responsibly. But if the small kids are seeing you going to bars and just standing recklessly everywhere, what do you expect them to do in schools? But I really don't think that schools are that much of a spreader. I don't know what Kama said. My suspicion is let students learn, but Kama can tell you something.
Thank you very much. The question that we deal with all the time in public health is a balance between social and economic activities and the lockdown. And that's a difficult decision for anybody, any leader. My team has recommended very, very stringent lockdowns. But we've also agreed that it should be done in a moving order. So schools will be closed if you continue behaving the way you do. So the closure of school is not about the governors or the president. It's about the way we behave. In the Lake region, we had created a special program called Adopt a School Initiative, where we are appealing to everybody from this region to give something back to the school that produced you. Be part of the movement that provides water, soap, and masks to the kids there. Do not wait for the Indian community to do it for your own school, or for somebody from Iceland to donate to your own school. So it is our belief that we can keep our schools safe if we behave safe and if we contribute towards that. On the offer from Governor Joho, and as a health person I can tell you this, right now I do not think that there is any county that has extra staff. There isn't. Talk to the doctors in Mombasa and they'll tell you that. So let's be serious about here. It's not a question of moving people. It's a question of making people do what is right. So if any governor has a way of making our people do what is right, I would welcome that more than 1 or 2 nurses who may even fall sick on their way to Kisumu. Thank you.
Tumalizie hapo. Watu. Yeah.